Hello and welcome to Health Professional Radio. Thank you so much for joining us today. I'm your host, Neal Howard. I'm in studio today with Jennifer Steiner. Now, Jennifer's the CEO of InnerChange, a family of residential and outpatient mental health treatment programs for adolescents and young adults and their families. And she's here today to talk about data-driven treatments and their outcomes. There's a lot of accountability that I guess needs to be fostered in the current mental health care industry. And Jennifer's here today to talk with us about some of the changes and how data is making some of those changes happen. Welcome to Health Professional Radio, Jennifer.
Thank you, Neal. It's a pleasure to be here.
Thank you. Thank you. Now, when we're talking about data-driven treatments in the current healthcare industry, what exactly are we talking about?
Yeah, great question. The word data is being used a lot now in mental health. I think there is a growing awareness that we need to be a little bit more precise and to be accountable to the care we're given. That we need to show that the care that we've provided has actually worked. But when we speak about data-driven treatment, we're really taking that a step farther, Neal. So in addition to having data to show that the treatment that we provided worked, that there was actually change in the client or the patient throughout the course of treatment, we are actually using data to direct the way that we're providing treatment. So we are collecting hundreds of points of data all along the course of treatment. And a residential program that we provide, a client is often with us for up to 12 months. So we are collecting data as frequently as daily to determine how the client is doing. And then our treatment teams use that data weekly. They look at all sorts of points of data and they reference that as they make decisions about what to do next in the course of treatment.
Electronic data, what types of data are we collecting?
Oh, that's a great question. So much of the data that we collect is either self-reported by the patient data or data that is collected by the clinician on the patient. So, and it's more than just notes. We're actually using internationally validated assessments on the diagnostics, the primary presenting diagnoses, on other co-occurring diagnoses, etc. So it's very objective. It's very structured. It's not sort of general observation.
We mentioned the word accountability early on. In your practice there at InnerChange, accountability, are we talking accountability to the patients themselves or the researchers or the payers? Who exactly are we talking about this accountability to, and who benefits from this data collection the most?
So I would say we have accountability to a number of constituents. Most importantly, we have accountability to the client and their family. So we have to be able to demonstrate that the treatment we're providing is actually making a difference. So we are touching base with that client's family as regularly as biweekly, where we're communicating how the client is doing. We have enough data within our systems to understand what a normal course of treatment would look like for someone with that diagnosis. So when we speak to a family, we can say, okay, well, most people with this diagnosis at this point in treatment are here, and here is where your child is on the course of treatment, and here's some of the changes that we're going to be doing in order to get them back to where they need to be. Or we're very confident in how we're treating your child, and therefore we're going to continue this course. But I would say in addition to that, we are accountable to insurance providers that are a payer for a particular client. We are demonstrating that things are improving. And we're also accountable to ourselves. We have clinicians and teams that are treating a patient, and we're not seeing the kind of progress that we need. We make changes. We make changes in the person. We may need to remove someone from a team because they're not being effective, or we may need to make some adjustments in how they're being managed. So.
How much leeway do you give your practitioners to, adapt your core methodologies to specific clients, take this out, leave this in, and things of that nature? Or is everything written in stone, for lack of a better term?
Yes. Well, we call this the both and, Neal. So we are very rooted in data, and we know certain things work without a doubt. And at the same time, we know that we are dealing with a human condition here, and there is a great deal of artistry required. The very best clinicians know how to be creative in the moment and to incite change in a patient or a client. So we're doing both, and there's certainly a great deal of autonomy given to a clinician to do what they need to do within the therapeutic experience to incite change.
How much training do your physicians receive as far as understanding cultural diversities among clients and then adapting the methodology?
Yeah. So all of the clinicians that are employed by InnerChange have gone through, they're all certified and have an education and degrees in therapeutic treatment. So certainly much of the training that they've received has been through that. So whether it's bachelor's level or master's level, depending on their position. And in addition to that, InnerChange has invested heavily in training for our core methodology. So, and that is folks receive training right out of the gates as when they join our company, and then they go through rigorous training, which can be upwards of 2 to 3 to 4 days solid per year, where they're immersed in our core methodology. So I'm actually quite proud of the amount of investment that we've made to ensure that our folks are trained very, very well.
Now, dealing with families, how often do you run into challenges getting the family to understand this counterintuitive approach, this data-driven type of treatment, and this hands-on when maybe they've come to you because other things didn't work, but they're still kind of ingrained in what they were used to?
Yeah, that's very insightful, Neal. So as I've expressed to you, I think in a previous interview, we believe passionately that the family system needs to be healed, right, for things to improve in a sustainable way. So a family that might come to us without really much of a willingness to participate can be quite problematic. Because and that's actually a requirement of admission into our programs. If we have a family who is staunchly opposed to participating, we may actually choose to not admit that family and that patient because we know it doesn't work. So it's generally a requirement that we make. As far as the data-driven component goes, Neal, I am finding more and more people in our world are taking their healthcare really into their own hands, and we are getting pretty sophisticated folks coming to us and saying, "I want to see the data, right? Show me what you're doing works." They're really advocating for themselves and their families, and I'm excited about that. I'm excited that I think we have a country of folks emerging that are really going to require healthcare providers, even outside of mental health, to be accountable for what they're providing to them.
And where can our listeners go and get more information about InnerChange?
Yeah, we'd love for you to come to our website. It's actually an online resource for all mental health related issues for adolescents and young adults, and that is at InnerChange.com, INNERCHANGE.com.
Great. Well, it's been a pleasure talking with you today, Jennifer.
Great. Thanks for the time, Neal.
Thank you. You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Jennifer Steiner, CEO of InnerChange, a family and residential and outpatient mental health treatment program for adolescents, young adults, and their families. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.